It's helpful to know where the facial foramens are located when it comes to dermal fillers, because where a facial foramen is, a nerve and vessels will also be found. Some of the arteries that arise from foramens don't get as much attention as the other major arteries of the face. I'm bringing attention to the arteries because there is a possibility of vascular occlusion with them. Foramens are also common landmarks for nerve blocks. The stylomastoid foramen is the site of the facial artery and is a common site for the facial nerve block. It's located back here. The infraorbital foramen and mental foramen, here's infraorbital and mental foramen, are common sites for nerve blocks for dental work or lip fillers. And I'll show you here. The infraorbital foramen is located right about here, and the mental foramen is located right about here. These are common sites for nerve blocks for dental work or lip fillers. I'll start with the stylomastoid foramen, which is located posterior to the base of the styloid process and is the exit for the facial nerve, cranial nerve 7. This foramen is a landmark used for some facial blocks. It is back and far away where most fillers aren't injected. Moving on up into the face, you'll find the zygomatical facial foramen, and I'll show you where that's located. It's on the lateral surface of the zygoma, typically at the temporal process of the bone. The zygomatical facial nerve, artery, and vein arises from here. This foramen is not present in everyone, but it's important to know that this foramen and artery does exist, since we typically inject here during cheek augmentation. Just like all areas of the face, aspirating with an unprimed needle can be helpful in identifying if we are in a vessel. It's not to say that if we do not get blood, that we aren't in an artery. However, if I aspirate here and I see blood, you better bet I'll reposition my needle before injecting. In addition, since we also have a nerve at the level of our foramen, patients will often feel pain and may act jumpy if the needle touches a nerve. This is another sign to reposition our needle. We don't want to inject filler where a patient is feeling unusual discomfort. I use that as a sign that it's probably not an ideal place for filler. As we go more superiorly, we can find the supraorbital foramen, which is just above the eye socket at the superior orbital margin. And I'll show you where that is. Right about there. It contains the supraorbital artery, vein, and nerve, the nerve of which is a terminal branch of the frontal nerve. In actuality, it is not always a foramen that is located here. I recall reading a study that looked at 100 skulls and found that there were more people with a notch at the edge of the orbital bone rather than a foramen. For me, when I think of why this foramen or notch is important, it's because this is a possible area that a neuromodulator could get into, causing an eyelid ptosis. In addition, filler injected into this artery could backflow into the internal carotid system, risking blindness or stroke. If we move all the way down to our chin area, which is such a common area to treat when it comes to filling for facial balancing or reducing muscle contraction for a smoother chin in appearance, in this area we also have that mental foramen. Here we will find the inferior alveolar nerve, often with multiple branches, and the mental artery and vein. The mental artery is a terminal branch of the inferior alveolar artery that comes from the maxillary artery. The mental artery supplies the mentalis muscle and the skin of that chin region. This artery often anastomoses with the inferior labial artery and the submental artery. So here is our mental artery, and it often anastomoses with that inferior labial artery, and it often anastomoses with that submental artery. And I can't forget to mention, in the anterior cheek, you'll also find the infraorbital artery. If we go back to that infraorbital artery here, it is possible to get the needle into that foramen. I typically use a cannula in this area, but when I did use the needle here, I found there were occasions when my needle depth seemed unusually deep, and I needed to back my needle out and reposition. I found my needle was not as deep when I knew I was on bone rather than in a foramen. Also, patients tend to be a little more sensitive if the needle goes here because of the inferior palpebral nerve that is found here, which is the smallest branch of the infraorbital nerve. There are different variations, and it's possible that an infraorbital foramen may not be present. There could be also an accessory infraorbital foramen. The infraorbital artery is a branch of the maxillary artery which comes off the external carotid artery. Along the anterior cheek of the infraorbital foramen, it branches to the zygomatic malar branch, vestibular branch, to the upper lip, deep-lying nasal branch that often anastomoses with the dorsal nasal artery and supratrochlear artery. The infraorbital artery supplies the inferior palpebral area of the lower eyelid, the lateral side of the nose, and superior labial or upper lip tissue. All this is important because it's a common injection site when filling the anterior cheek. Interesting how many interconnections these arteries have. There was a case study by Soares and Belvins published March 2022 that discussed an infraorbital arterial occlusion from injecting filler. The infraorbital artery branches off the maxillary artery, and in this case the patient had necrotic tissue not only in the region of her infraorbital artery, but the occlusion also affected her ipsilateral palatine artery, and she had ulcerations on her palate. In summary, it's important to remember that we have arteries that come from foramens, and although this can vary from one person to the next, please note that some of these arteries do connect with our internal carotid system, and like other areas of our face, they anastomose. So a problem in one area could affect other areas. If you found this information helpful, please like and subscribe for more, and if you have any content that you'd like me to expand upon, please leave a note in the comments below.